A little bit of suspense with the music, I think. So in a little bit less than 2 minutes, we'll be sharing a very special announcement about the upcoming Teach to Reach conference and how it aims to contribute to support immunization staff who will be called to work on introducing vaccines to protect the individuals and their population from the COVID-19 disease. See you soon. All right, we have a very special announcement coming, and very pleased to be sharing this across all platforms. We're live streaming this special announcement. I'm Reda Sadki from the Geneva Learning Foundation. You'll find this announcement on LinkedIn. So welcome to you if you are watching us on LinkedIn. I see some folks who are already joining there. You can also watch this announcement on YouTube, Twitter, and on Facebook. So warm welcome to you. We're going to get started. This is about Teach to Reach. Teach to Reach is a program of the Geneva Learning Foundation supported by the Bill and Melinda Gates Foundation. We are pleased to announce today that between the 26th and the 28th of January will take place this conference, and a very, very important part of it is going to focus on the capacity building, training, learning, and performance components. Everything that is going to be needed to move people, immunization staff, to take the instructions from their Ministry of Health and actually execute on the introduction of the COVID-19 vaccine. With me is Charlotte Mbu and Ian Steed. Charlotte and Ian, how are you doing?
I'm doing great, Reda. Thank you. And greetings to all those who are joining this session via our various platforms, LinkedIn, Twitter, YouTube, and Facebook.
And Ian, how are you doing?
I'm good, thank you, Reda, and likewise great to see so many people joining us for this announcement.
Great, so we have Amel Elta here, who's connecting from Quetta in Pakistan, Rahul Soho. I'm not going to be able to give everyone's greetings, but I'm going to try to give a few. Abdul Wajid, who says, hello, everyone. Remember to tell us what city and country you're connecting from. Dr. Tanushri Mandal from West Bengal, India, who's coming in via LinkedIn. Okay, and we actually have our first Twitch follower that I think is a bit of spam, so we'll ignore that one. Very excited to be a part of it and looking forward. Yes, indeed. Yin Yin Te joining from Myanmar. Izuogo Promise from Nigeria. And Sahini Senal, who joins us with applause. Thank you, Sahini. Tanushri, who shares her excitement. All right, we're going to do this as a Q&A. So Charlotte, the honor of the first question goes to you.
Thank you very much, Reda. And my question is going to be pretty direct. What is the Teach to Reach conference all about, and why do you think now is the right time to be organizing it?
All right, so Teach to Reach has this kind of long history. There were 3 face-to-face conferences that did what face-to-face conferences can do. What we're doing in the middle of the pandemic, we don't know if it's the beginning, the middle, or we're getting close to the end of a pandemic, but whatever it may be, is building a fully digital conference that is going to be driven by immunization staff from countries. And that's going to be focused on what are your priorities right now. And what are your priorities going to be in 2021? We know that GAVI, the Vaccine Alliance, has announced that there'll be, by the end of 2021, there'll be 2 billion doses of vaccine to protect individuals from COVID-19 disease. How those doses get from their manufacturer to the people who need the vaccines, that is going to be in the hands of the immunization staff. That's you. And that's why we're having this conference. We're going to focus on what it's going to take to build the competencies, the capabilities that are needed to make this successful. Charlotte, back to you. Yep.
Thank you, Reda. My next question, who are those who should be interested in this conference? Is it only about the scholar community, or should other immunization professionals get interested in the Teach to Reach conference?
So Teach to Reach is focused on specifically on immunization training, all right? And specifically on COVID-19 vaccine introduction, that's going to be one of the most important tracks of the conference. However, it is going to be a big tent for everyone who works in public health, not only in immunization, will be welcome to join if you are interested in these issues and potentially interested in using what you can gain from this conference, what works in immunization training for your own needs. So it's going to be quite open. The focus of the content, the sessions, the activities, the workshops, the expo will be on specifically on immunization training. I want to go back. There's quite a few people joining here. So Samuel Atidza, thank you for joining us, and welcome, Samuel. You don't tell us, Samuel, where you're joining from. Brima, connecting from the Gambia. Joshua from Kenya. Dipesh Shrestha, who says hello. Okay, thank you, Samuel, from Ghana. All right, and Raul says you're having a technical issue with double sounds. Let us know if you're having that problem as well. Great to see you all here. Very excited. We're excited as well. Thank you. Dr. Bala Gane Sakumar from India. Welcome. All right, Tanushri, great initiative, need of the hour. Thank you. Abubakar Tahir from Facebook says, very interesting. Subhadip is very excited to join. And Dr. Tanushri Mandal, a big step. We're all welcome to join hands around the globe. Our Sohini Sanyal, I say our because she's a member of the COVID-19 Peer Hub and I believe of the Teach to Reach initiative. Very happy to finally see a conference focused largely on capacity building and immunization. This is going to be awesome. Let's have a round of applause for Sohini before we go to the next question and all the others who have shared their comments. Remember, you can ask us questions as well. All right, with us in the room, we also have Ian Steed. Ian, what is your first question about Teach to Reach?
Thank you, Rada. Rada, you've mentioned several times now that this is going to be a conference based on the needs of immunization professionals. How are you going to make that happen?
Thank you. Great question. So this conference is going to be driven by the community and by its needs in a number of ways. I think the most significant is that the organizing committee, which is usually just a few people that are handpicked, people in the know or people with the right level who are very experienced or very expert. We've chosen a different path, which is that we started with 3,000 immunization staff who joined the Teach to Reach program in March 2020. From that process has emerged a group of 282 learning leaders from all levels of the immunization system. So whether you can be in this organizing committee, you will find people who are working in a health facility in a remote village, and you will find people who are in the central planning team for their EPI team, for the expanded program for immunization in their country. So that healthy mix, that diversity, we believe is the key to actually building a conference that will be focused on what the real needs are without any filters, intermediaries, or gatekeepers, or by minimizing those to the greatest extent possible to really put together something that will be driven by and for the community.
It sounds fantastic. So how do I join this conference? What do I need to do? Will I be able to contribute something to it myself from my own experience?
Absolutely. So step one is going to be, the announcement is not out yet. I can't give you the link where you can go and register right now. So what I'm going to ask is keep an eye on whether you found us on LinkedIn, YouTube, Twitter, or Facebook. Wherever you're most comfortable is where you're going to see the announcement and the link to register for this conference. Now, registration is not just going to be your usual step where you just click, okay, yes, I'll attend this and be there on those days and so on. We're going to be asking you to sort of check in with you. What is the COVID-19 situation where you work? What's going on? What are your priorities? What are your needs? And that will inform the design and development and content of the conference. So if you tell us that you've heard things about cold chain with respect to at least one of the vaccines, and you'd like to know more about that, that means we will go and find the global expertise to help you with that. And we'll also call for practitioners who have significant experience in cold chain to contribute to the conference. If it's about vaccine hesitancy, we'll use the same approach. If you tell us that's what your burning concern is, you're worried that what you saw when the pandemic first arrived, where you saw all kinds of nonsense circulating on Facebook or WhatsApp, and you're worried about what that will look like when there is an actual vaccine, and not just rumors about clinical trials, how to prepare for that. Then we will call on and invite the people with significant global expertise, and we'll invite the community also to contribute to that process. So that's how we hope to build something by and for the immunization community. Charlotte?
Just one last thing I want to know. We know that in the COVID-19 Peer Hub, we have a number of country groups that's made up of Peer Hub participants. Is there anything in particular that we'll have to expect from these country groups during the Teach to Reach conference?
Absolutely. So the country groups were actually created in July 2019 during what we call the Impact Accelerator, which brought together teams, and there's this incredible dynamic of people sort of getting on the move because they wanted to make a difference for the immunization program performance in their country. Then yes, when COVID came, it turned out that these teams grew and were reinforced by a COVID-19 focal point in addition to the team leaders. So these country teams, in some countries, there are scholars who've completed one or more of our programs who are connected to each other, who are really digitally savvy, who've shown that they can excel in learning, capacity building, and actually executing an action plan. Not just developing the action plan, but executing it. So those teams in the countries where they exist, there's around 24 countries where they're already in place, are going to be super important. And in fact, many of them are doing significant work, contributing to their country's efforts to respond to the pandemic. And they will get to share their experience, what they have done and how they have done it. And there will be a lot of peer learning and inter-country exchange during that period.
Thank you very much, Reda. Sounds very interesting, but before we go, I just wanted you to remind those who are watching the dates for this conference so that they can already lock up their calendars.
Yes, so it'll be over 3 days. You don't need to be there for the full 3 days, but we have so much going on. And obviously, COVID-19 vaccine introduction is going to be such a big topic alongside the other tracks that we'll have. It would be good to reserve, as Charlotte suggests, some space in your calendar. So let's see what we've got. Let's see if we've got any questions. So I'll just work through this. Abubakar Tahir says, okay, thank you, Abubakar, for specifying. And tell us what you do in Nigeria, Abubakar. Gunjan Tanehas is a great initiative. Thank you. Dr. Tanushri Mandal, okay, yes, is actually providing technical support. That's just amazing. Maria Fernanda Monzon, I'm so excited and honored to be part of this conference. And Maria is a member of the organizing committee from her country and will be representing, I believe, is the sole representative from her country. So, and then Subharip, vaccine hesitancy as well as vaccine eagerness both need attention in this conference. Yes, indeed, that was one of Lisa Menning's comment from WHO about what we might expect. Among the multiple initiatives on COVID-19 vaccine rollout, the diversity and inclusivity is what sets it apart. Yes, thank you, Gunjan. That is certainly what we hope. And again, the hardest part is really, and potentially the most valuable part, is going to get global partners who have that global vantage point across all countries and responsibility to all countries to connect with people who are in the field at many different levels of the system. Thank you, Lavele Osumbo. All right, Tanushri, yes. TGLF has been working tirelessly regarding immunization. This is going to be the stepping stone. Very, very happy to call myself be a part of it. Very happy, Tanushri, that you are indeed also a part of the organizing committee. And then Deepesh Shweta, will it be like SIA planning? I'm not sure what you mean. Let's go to Ian and Charlotte, each for one last question.
I think I'll just turn towards Ian. Reda?
All right.
Thank you, Reda. You've been very comprehensive. My last question. Scholars are so busy. We know we're part of the Global Peer Hub. This is another conference. What can you say to, just to that last encouragement that says, look, this is worth doing? What's this conference in a sentence for you?
So, I don't have a one-sentence answer. My thinking is that there'll be lots of initiatives going on around COVID-19 vaccine introduction. We're hoping that a significant portion of them will contribute to this conference, that this will be an opportunity to connect many different initiatives, many disparate initiatives, and that this backbone of the more than 6,000 immunization professionals who joined the Peer Hub in the last 3 months will help make this real, keep this conference true to the ground and true to the needs, so that immunization staff from countries, as it might be overwhelmed and submerged by what they're being asked to do above and beyond in order to introduce this vaccine, might also make their voices heard and engage in constructive dialogue, where they will be able to leave knowing that there is a global community that supports their hard work that they're doing every day. So those would be my thoughts. There's several more. All right, we're not going to be able to share all of the comments.
Reda?
Yes?
Thank you, and thank you so much for Olatunde, who has just pointed out absolutely correctly, the date at the top of the screen should of course read the 26th to the 28th of January 2021.
Right.
Thank you so much for the eagle eyes out there.
Yes, thank you indeed. I hope this won't confuse. Okay. All right, that's quite embarrassing, actually. We're fortunate that this is a pre-announcement. I did not spot this, even though, of course, this is going to happen in 2021. Thank you, Ian, for this last correction. All right, we'll end with some final comments from Amel El-Tahir. I'm so excited to be in the conferences forum. It had helped me a lot to build my capacity. Subehendu, who predicts it will be a great success. Felicia, who says, hopefully the scope of the conference will be broader. Yes, Felicia, there'll be a lot around immunization. Again, the focus is very specific for Teach to Reach. It's immunization training, but in the broad sense, and Subhendu is proud to be a part of it. I think that's it for today. Thank you. And this is just a pre-announce. We wanted to test the waters and see what might come out of initial engagement. See what the questions would be, what the comments and feedback will be. So, thank you very much for having joined this briefly announced pre-announcement for the Teach to Reach conference that will be taking place from the 26th to the 28th January 2021 and not a year ago. Thanks, Marie-Ève. We're going to keep live streaming just so we can there's a delay in the comments. So if you have any final comments or questions, now's your chance. Thank you and see you soon. Again, to be the first to hear about the conference, make sure you're following us on LinkedIn. You just need to follow our page on YouTube. You can subscribe to the channel, get the notifications, Twitter and Facebook. So you'll be the first to hear about the Teach to Reach conference. The announcement is imminent. This is just a pre-announcement. Look forward to seeing you and getting more feedback, more inputs from you, so we can make this an exceptional event. Thank you and take care.